Good morning and welcome to Take Your Life Back Today show with Ralf Friedrichs. Today's topic is going to be alcohol, benzos, and opiates. The withdrawal might just kill you, and we're going to do a continuation right into the deadly mix of combining those three. But first, as always, I want to give a shout out to Dr. Luis Gonzalez from startingpointmn.com. You can reach him at 844-414-8444. Dr. Luis Gonzalez will walk with you from your recovery, from your addiction to your recovery 24 hours at a time, day by day. He will never ever talk about your past. He is an addiction recovery coach. He's not a therapist and he's not a counselor. He is there to help motivate you, to help release whatever questions you have, the answers that you already have inside to the surface. That's Dr. Luis Gonzalez from startingpointmn.com. The MN stands for Minnesota. Also, Dr. Luis Gonzalez can turn you into an addiction recovery coach. That's right. I am a graduate from his educational program at Starting Point. Now, if you have personality, professionalism, and a passion, and you have some sort of addiction background, whether it's your own addiction background or helping others, call him at 844-414-8444. That's Dr. Luis Gonzalez from startingpointmn.com. Let him help you take your life back. Also want to give a shout out to globaleyeglasses.com, where they are focused on saving you money. Global Eyeglasses has frames that start at $6, as low as $6, and go up to about $49. Now listen to this very carefully. These frame prices that I just quoted you, from $6 to about $49, include the following. They include plastic, non-coated, clear, standard RX single vision lenses. They include a cloth. They include a case. That's all for the price that I just told you. So if you find a frame online that is, let's say, hypothetically speaking, $6, it will include standard non-coated plastic lenses, a cloth, and a case. You need to go to www.globaleyeglasses.com, and they are focused on saving you money. And if you have any questions about this company, you can text me at 631-599-0218. Not only am I board certified optician, so I can help you with any questions you might have optically speaking, but I happen to know this company very well. So reach out to me, 631-599-0218. That's globaleyeglasses.com, where they are focused on saving you money. Folks, go to my website to preview any video that you'd like to see, any episode. That is www.takeyourlifebacktodayShow.com. You can also go to my other videos, www.clearviews.info. That website is about all information on drug and alcohol. You can also go to www.clearreform.com. Now, Clear Reform is pretty much what Dr. Luis Gonzalez does as far as helping you go from your addiction to your recovery. You can also go to find me on Facebook and on Twitter, but on Facebook you can find three different pages. Well, two pages in a group. First one is Take Your Life Back Today show. Second one is clearviews.info, and the open group so you can join is Clear Reform. Shout out to me there. Twitter, you can Google, circle me. You can find me anywhere on the website. There's over, I believe now we are over 50 different websites that support our cause on fighting addiction, bringing awareness to the drug and alcohol epidemic in this country and globally. Folks, let's jump into this. Alcohol, benzos, and opiates, the withdrawal that might kill you. Let me just move this over a little bit so I can see it better. There we go. Along with teaching and telling stories, part of my goal here is all about addiction, to get the important information out to you so you can benefit, whether it's for yourself or maybe for someone else. Most drug users who quit drug use cold turkey have to go through a withdrawal of some sort. Withdrawal is never comfortable, but sometimes it can actually be dangerous. The list that I'm going to go over outlines some drugs that should never be quit suddenly without medical supervision. But sometimes it can actually be dangerous if you try to do it without medical supervision. This is the reason why some rehab treatment centers use the medical detox period lasting anywhere from 2 days to a week or more. In other words, they gradually bring you down. Which withdrawals can kill you, actually kill you? Alcohol. Yes, After long use, withdrawal from alcohol can kill you. Alcohol withdrawal syndrome can take on mild, moderate, or severe forms. If while withdrawing from alcohol, a person develops a fever, extreme nausea, diarrhea, or DT, which is delirium tremens, they need to be rushed to see a doctor as soon as possible. In fact, alcohol withdrawal after heavy chronic use is best managed under the care of a doctor or a professional medical detox unit, such as a treatment center or a rehab center. By using medications that relieve withdrawal symptoms, these professionals can essentially eliminate any of these risks. Let's go to benzodiazepines. I can't pronounce the word too well, so I just call it benzos. Benzos are introduced as a replacement to barbiturates that were causing common overdose cases. Many have resulted in death. Nevertheless, withdrawal from extended use of benzos can kill you. Whether Xanax, Activin, Valium, or any other variations, long-term use of benzos requires medical supervision to be completed successfully with the minimal side effects that risk might have to the patients. Normally, the withdrawal process is managed by slowly reducing the dose and transferring the patient from a slow-acting to a long-acting form of this drug. Still, full resolution of benzos withdrawal symptoms can take up to 6 months, sometimes even longer. Opiates. Let me just control this brightness a little bit. There we go. Oh, that's good. Right there. Okay. Opiates. Many people are surprised to learn that most cases withdrawal from many opiates is not deadly. Still, there are some very important exceptions. Methadone, a long-acting opiate, often prescribed as a replacement for heroin, can cause death during withdrawal if it is consumed in high enough doses for a long amount of time. Much of the danger in withdrawal from all of these drugs has to do with the body's response to the extreme changes in the chemical process going from the brain to the rest of the body. Alcohol, benzos, and opiates interference with the GABA system, the body's most common down regulator, can have a killer, and I mean killer effect. Withdrawal from these drugs is like trying to turn the heat up in a cold house with a broken thermostat and an out-of-control heater. It won't always lead to disaster, but it's a bad idea to do it. This was alcohol, benzo, and opiates, the withdrawal that might kill you. And that was important that I bring that up. And we'll just do a quick recap. Alcohol, benzoids, and opiates might kill you. If it is from alcohol, after long term of alcohol, when you want to start withdrawing, you need to have a professional help you. By using medications that relieve withdrawal symptoms from alcohol, these professionals can essentially eliminate any of the risks. From benzos, if you are doing a withdrawal, benzos were introduced as a replacement of barbiturates that were causing common overdose cases, many of which resulted in deaths. And we probably have heard so many of these. Nevertheless, withdrawal from extended use of benzos can kill. Whether Xanax, Activin, Valium, or other variations, long-term use of benzos requires medical supervision. What they will do is slowly bring you down, and it might take up to 6 months to get you to withdraw from them. Opiates. Many people are surprised to learn that in most cases, withdrawal from opiates is not deadly. Still, there are some very important exceptions. Methadone, a long-lasting opiate often prescribed as a replacement for heroin, can cause death during withdrawal if it's consumed in high enough doses. Folks, the bottom line really is that all three of these need to have the supervision of a clinical or medical establishment or doctor. Let's go into deadly mix: opiates, alcohol, and benzos. You cannot mix them at all. Opiates, benzos, and alcohol are among the most frequently prescribed and non-prescribed and most commonly used drugs in the world. All three drugs have a tremendous therapeutic value to reduce pain and anxiety in patients with acute chronic illnesses. Not alcohol as much, but people still use it. Independently, each one of these drugs also has a high potential of misuse, abuse, and overdose when it's used for recreational purposes. When combined all together, opiate, benzoid, benzos and alcohol can and probably will be deadly. Who combines these three of alcohol, benzos, and opiates? Most people use either opiates, benzoids, or alcohol drugs, whether it's prescribed by a doctor or not. Doctors generally avoid prescribing both benzoids and opiates for one patient, as members of the medical community are aware of the risks posed by using both of those drugs together. But then people seem to add a different thing, and that would be to add alcohol, possibly to wash down the pills of the opiates or benzoids. Many people who take both benzoids and opiates together do so for recreational uses and not for therapeutic purposes. Benzo abuse is especially common among opiate-dependent individuals using methadone as part of a drug maintenance program. In one survey of patients in methadone program, 47% of respondents had a history of benzo use or abuse, and 38% had used prescription drug without a prescription. More than half of respondents, 54%, started using benzoids after enrolling in a methadone program, and 61% of those who had used benzos before methadone treatment resumed benzos use or even increased the quantity usage. Benzo and opiates uses and abuses. Doctors commonly prescribe benzoid to help a patient manage anxiety or insomnia. Doctors also administer benzoids as a sedative before medical or surgical procedure for the treatment of seizures and acute agitation. Sometimes clinics prescribe benzoids to help patients through withdrawal from alcohol and or opiates. Known side effects of benzoid include drowsiness, fatigue, and the loss of control over bodily movements. Opiates, sometimes called opiates, sometimes called opioids. Wow, that's a tough one because the first word is opiates, sometimes called opioids. They sound the same to me. So opiates, sometimes called opiates, are potent pain relievers. Similar to benzoid, opiates can cause sedation, decrease mental alertness, and depression. Opiates also create a pleasant sense of euphoria that makes this class of drug attractive through recreational users. Combining benzoid, opiates, and alcohol can cause death. Combining benzoid, alcohol, and opiates can be very dangerous and even life-threatening. All three medications are nervous system depressants, which mean they each act differently on the parts of the brain responsible for essential functions, including breathing. Together, benzoids, alcohol, and opiates can suppress the respiratory center of the brain to slow breathing to a point of stopping. Ultimately, death is possible. People who die of drug overdoses frequently had a combination of opiates, benzoid, and alcohol in their bodies, according to the Centers for Disease Control and Prevention. In fact, opiates were involved in 71% of all overdose deaths in 2013, and benzoid were involved in 30%, with some deaths resulting from more one type of drug. All three combined have an astronomical amount of percentages that I don't have in front of me, but from what I understand, it's higher than 71%. Individuals who combine benzoids and opiates and alcohol are at risk for great bodily harm, even death. Using the drugs strictly as prescribed or looking for an appropriate drug treatment when addiction is present is the only way to reduce this risk. If you or someone you know is addicted to benzo, opiates, and or alcohol, reach for help or help them reach for help. Discuss with the prescribing doctors your concerns and options for them or yourself. We are here for you. We are here to help you with any maybe guidance towards trained professionals. We are not trained professionals here at Take Your Life Back Today show. We are the messengers. I am a addiction recovery coach, so I will coach you to the right channels. But what you need to do is you need to reach out and you need to call me at 844-405-HELP, 844-405-HELP, and I will get you to the proper channels. We are here for you, and our trained and caring professionals are available to explain how the Wasman method has helped so many people to overcome the addiction to the dangerous drug combination. When I say we are here, we are not the trained professionals, but I will get you in touch with the trained professionals. I will also give you a copy of the Wasman method should you decide you want to go with that. And if you don't want to call me at 844-405-HELP, you can text me at 631-599-0218. You can also email me at Ralf at Take Your Life Back Today Show. That's RALF at TakeYourLifeBackTodayShow.com. Let's do a recap on the deadly mix of opiates, alcohol, and benzos. Opiates, alcohol, and benzoids are among the most frequently prescribed and non-prescribed drugs used by not only regular people, but for recreational purposes by all people that use this. Usually starts off as recreational for most people. I mean, there are some prescriptions out there that people use for medical conditions, but mostly people use these drugs for recreation. It's sad, it really is. All three of these drugs have tremendous therapeutic value to reduce pain and anxiety in patients with acute or chronic illnesses. Independently, each of these drugs, and alcohol is a drug, so if anybody wants to say, well, alcohol is not a drug, it is a drug, also has a high potential for misuse, abuse, and overdose when used in recreational purposes. That is the key thing. Only use, except for alcohol, because I don't think any doctor prescribes alcohol, only use opiates and benzoids if it is prescribed for a medical reason. Do not, I repeat, do not use it for recreational. Who out there combines all three of these together, benzoids, opiates, and alcohol? Most people use either opiates, benzoids, and alcohol, or I should say most people use opiates and benzoids if they're prescribed by a doctor. Alcohol is never prescribed by a doctor. Doctors generally avoid prescribing both medications for one patient, as members of the medical community are aware of the risk posed by using both drugs together. And then when people start washing these drugs down with a shot of whiskey, then you're playing Russian roulette. Many people who take both benzo and opiates together do so for recreational uses and not for the therapeutic purposes. Benzo abuse is especially common among opiate-dependent individuals using methadone as part of a drug maintenance program. In one survey, a patient in a methadone program, 47% of respondents had a history of benzo abuse, and 38% used a prescription drug without even having a prescription from a licensed medical professional. More than half of respondents, 54%, started using benzoids after enrolling in the meth program, and 61% of those who had used benzos before methadone treatment resumed benzos use, even increased their usage. Folks, the bottom line really is that you can't combine. Number one is that you should never use a prescription drug if not prescribed to you. Number two is you can't combine different drugs together. And number three, you can't wash the drugs down with alcohol. Benzoid and opiate uses and abuses. Doctors commonly prescribe benzoids to help patients manage anxiety or insomnia. Doctors also administer benzoid as a sedative before a medical or surgical procedure for the treatment of seizures and acute agitation. Sometimes clinical personnel prescribe benzoids to help patients through withdrawal from alcohol or opiates. Known side effects of benzoid include drowsiness, fatigue, and loss of control over bodily movements. Opiates, sometimes called opiates, again, that's that same word, I don't know, this has to be a misprint, are potent pain relievers. Similar to benzoids, opiates can cause sedation, decrease mental alertness, and depression. Opiates also create a pleasant sense of euphoria that makes this class of drug attractive to recreational users. And last and not least on our is combining the two together can cause death, and then when you add alcohol, that brings the percentage so much higher to possible death. Combining benzo and opiates can be very dangerous and even life-threatening. Both medications are nervous system depressants, which mean they each act directly on the parts of the brain responsible for essential function, including breathing. Mixing this with alcohol together it will affect the respiratory center of the brain to slow breathing to the point of stopping. Ultimately, death is possible. People who die of drug overdoses frequently had a combination of opiates, benzoids, and alcohol in their bodies, according to the Centers of Disease Control and Prevention. In fact, opiates were involved in 71% of all overdose deaths in 2013, and benzoids were involved in 30%, and a combination of those two with alcohol was even higher than 71%. For some reason, people think that taking pills, prescription pills or non-prescription, if you're using it for recreational purposes, that by you being able to just go ahead and swig it down with alcohol makes it okay. It's wrong. On the prescription bottle, when it says, it usually clearly tells you to take it with a full glass of water. It does not say 2 shots of whiskey. Individual who combines benzoids with opiates are at high risk for great bodily harm and even death. Using a drug strictly as prescribed or looking for an appropriate drug treatment when addiction is present is the only way to reduce the risk. If you or someone you know is addicted to benzoid and opiates, reach out for help. Discuss with a prescribing doctor your concerns and options. We here at Take Your Life Back Today show are here to help you and guiding you to the proper channels to get this help. We're also here to tell you about the Wasserman method, which has helped so many people overcome addiction to dangerous drug combinations. Just reach out to us at 844-405-HELP, or you can text me at 631-599-0218, or you can email me at Ralph@TakeYourLifeBackTodayShow. That's RALF at TakeYourLifeBackTodayShow.com. Folks, if this does not clearly send a message about how prescribed drugs that are out there are being mixed with unprescribed drugs and being mixed with alcohol, and it has become such a killer that it's almost sad to even read these things to you folks. It makes my heart very heavy to have to do these programs, to have to do these shows, but it is my calling and my passion to bring this information into your living room, into your kitchen, into the jail that you might be serving time for possibly DWI or drug charge right now, into the homeless shelter because you're homeless because you abused drugs and utilized all your funds to do so. It is my job to bring all the information to you, because when I do this, when I bring you the information, it educates me daily. This is my rehab for my disease called alcoholism. This is not AA. This is my own method. My own method is 6 to 8 hours daily of educating myself, of doing my shows, of doing my websites, of answering questions, of doing my emails, of editing, of producing, and of bringing the messages directly to you. And I do this daily. There are some days that I do miss, Sundays and Thursdays, but on Thursdays I give you Throwback Thursdays from previous episodes, and on Sundays I try to give you inspirational videos, short clips, maybe 4 minutes, 5 minutes. And my message then is the message of hope, the message of faith, and the message of family. Those three are missing in today's society. They really are. And folks, if you're watching me and you are inspired by my commitment to giving you this information, and you are concerned of possible overdosing yourself, or possible abusing drugs and alcohol, and you think that today is the day for you to change, do these 2 things. Number 1 is you have to stop denying that you have a problem. Because when you stop denying you have a problem, things become better. And then you have to reach up to God, because you cannot battle any addiction without God. You need God for guidance and direction, because if your life was going perfect, you would be in the predicament you're in. Although drugs and alcohol is a disease, we as humans are not strong enough to guide and direct ourselves, and that's where we need God. Because God represents your hope, your faith, and that is the total ingredient, those two ingredients that you need to recover. Reach up to God and ask for guidance and direction. I use this example all the time. And for my regular viewers out in my audience, I'm sorry that I'm repetitiously saying these things, but it's important that I send this message during each and every show. Your body is equivalent to a ship. Your mind is equivalent to the captain. So you're in charge of your own ship. You, the captain, are in charge of your body, the ship. You would never take, if you were truly a captain with a ship, you would never take your ship out into a rough ocean without navigation, would you? Well, who is your navigator? Because obviously it's not you if you are recovering or still battling with substance abuse. Well, God is a navigator of not just you, of this universe. So reach to God, ask Him for guidance and direction. Let Him become your navigator. Because I can guarantee you this, God will never ever let your ship, your body, and you, your mind, you the captain, go into any rough ocean if you just ask Him to guide and direct you. God will guide and direct your vessel through any rough ocean, and you'll come out sailing in clear seas sooner or later. Carrie Underwood said it best, and she said, Jesus, take the wheel, when she sang that song. And it's so true, because Jesus does need to take the wheel of your vessel. No matter if it's a car, whether it's a ship, a plane, helicopter, you need to have God in the driver's seat. Because with God in the driver's seat, you are guaranteed to be safe. You're guaranteed to be guided and directed. Another perfect example would be at night we go to bed and we take our slippers, shoes, and sneakers off and we shove them at the edge of our bed usually. Well, tonight, do yourself a favor. Push those sneakers, slippers, or shoes under the bed halfway. Why do you ask? You might ask yourself. The reason is because tomorrow morning when you wake up, you will be forced to retrieve them from under your bed while you're on your knees. And while you're on your knees, why don't you thank God for another day on this beautiful earth? That He's allowing you to breathe. Excuse me. That He's allowing you to breathe. That He's allowing you to open and close your eyes. Because somewhere on this earth there is someone right now that is taking their last breath. Somewhere on this earth somebody's closing their last eye, closing their eyes for their last time. So today is the day, I'm sorry, I had to turn this ringer down, that you have to realize that you are blessed to be sitting there, to be breathing, to be able to blink, and to be able to hear the hope for change. Because for whoever that person might be that's closing their eyes for the last time or breathing last, my question to you is how do we know they had an opportunity for change? Did they possibly say, well, I'll change tomorrow? Maybe like you're saying right now that today's not your day, that tomorrow might be the day. But here it is. Here's the question. How do you know tomorrow will be here for you? I am here to give you the message that there is hope. There is hope for a better tomorrow if you change today. And I promise you this, folks. A sober today will give you a better tomorrow. And if you start thinking positive in your mind, you will get positive results no matter what you do. And if you reach up to God and ask for guidance and direction, you will find changes physically, mentally, spiritually, and financially. But it takes a dedication to the Lord Jesus and a dedication of you helping yourself. Isn't it time for you to get your life back? And isn't it time for you to contact me at 844-405-HELP or texting me at 631-599-0218 and asking me to help you take your life back? Folks, I hope each and every one have a great day in my audience today, but more importantly, I hope each and every one of you in my audience has a sober day, and may God bless you until next time.